हेलो एंड वेलकम टू आरोग्या फिजियोटिप्स। आपका आरोग्या फिजियोटिप्स में बहुत बहुत स्वागत है। सो टुडे वी आर गोइंग टू टॉक अबाउट द सी सेक्शन स्कार मोबिलाइजेशन और मसाज। ओके, जब आप सी सेक्शन करते हैं तो वहाँ पे कट करते हैं और वहाँ पे एक जो इंसिजन रहता है वो जब हील होता है तो बहुत लोगों को कई तरीके का पेन होता है. दे फील दैट इट इज अ वेरी सेंसिटिव एरिया और they start feeling numb in that area and it take little amount of time to completely recover. So what we are talking today is scar desensitization. So the scar which is left behind, how to completely desensitize it. We should not be feeling any kind of pain. There are women who have told me that after 2 years also they feel little pain or discomfort, which should not happen at all. So as soon as your scar heals and your obstetrics or gynecologist says okay, or your pelvic therapist says okay, you should start doing scar massage or mobilization. So mobilization और scar massage, actually scar किस टाइप के होते हैं? या तो एक पतला सा लाइन होगा or it will be a very thick line or thicker on the sides and thin in between. So in any of these cases you should do this massage. We will be showing you right away. अगर आप सी सेक्शन मदर है तो आप सबको ये मसाज करना चाहिए जैसे ही वो इंसिजन हील हो जाता है. आपका जो स्टिच किया है वो स्टिच वाला एरिया हील हो जाता है वो तो आपको ये मसाज और मोबिलाइजेशन करना चाहिए. Gynex says okay, we have to start the desensitization of scar. You can first desensitize by putting cotton pads or soft fabric first around the scar एंड ऑन द स्कार. मतलब आप स्कार पे भी ट्राई करिए और अराउंड द स्कार भी ट्राई करिए, ऊपर नीचे आगे पीछे हर तरीके से, बोथ अप एंड डाउन, साइड एंड साइड, एवरीवेयर. When you feel that your scar is completely healed and you are ready to start some desensitization of scar, the first thing you can start is by going above and below the scar. Of course, I'm not showing you the real scar. आप देखना तो बहुत चाहेंगे पर दिखना नहीं वाला है आपको क्योंकि वो बहुत नीचे है. So imagine if this is your scar, then you have to start using your fingertips and very gently go side and side, above and below, just side and side. Okay. Important is to go above and below, both. Okay. Once you are comfortable with side and side, you will also go up and down, very gently, very gently. Okay. You basically want to mobilize around the scar and you also want to improve the circulation around the scar area. Once you are comfortable here also, you will start circles, small clockwise circle around the scar, up and down. And once you finish the circle clockwise, you will also do it anti-clockwise. आपको clockwise और anti-clockwise दोनों तरीके से करना है. Once you are comfortable here also, you have to apply certain pressure. Okay. When you apply certain pressure and you feel any burning sensation or any sensation which is very uncomfortable, then please reduce the pressure. Okay, and continue doing the same pressure which you were doing earlier. Pulling laterally and diagonally is also something which you can do. Once you are comfortable all the ways, then you start doing it on the scar. So you go on the scar, same thing, first go side and side, and you will go side and side on the scar also and just lateral to the scar as well, side and side. And then you go up and down, up and down, up and down. And then when you feel your tenderness on the scar is reducing and you're feeling not so painful, try doing the circles. Okay. And with less pressure initially, clockwise and anti-clockwise, and after a period of time with more pressure. You have to make sure if you feel any thickness around the scar, you have to go little more deeper and try to
desensitize it and try to break the scar tissue as much as possible. Once you are comfortable here, also, you can go much deeper. You can even start pinching and pinch and leave, pinch and leave, pinch and leave. And once you are completely fine, then you can pinch and roll, pinch and roll. So you pinch and then roll upward as well as downward. Okay. And this will make sure that you don't feel that weird sensation around the scar. Also, if your scar tissue is thickened, then it will become thin and thin over a period of time. It is very important to do this, and it is part of your postpartum journey. So I would request all the C-section mom to do this as much as possible. Remember, it is part of your healing journey, and it is absolutely wrong to feel any burning or any weird sensation around that scar.
So remember to do this. Be very gentle initially. कभी भी ज़्यादा pressure नहीं apply करना है. हमेशा start gently करना है and pressure धीरे धीरे increase करना है. And if you have been already doing it and you feel that it has improved a lot, please comment below, क्योंकि over a period of time it will heal, and I would love to hear your stories. Also comment below if you want to make us some other video related to C-section or any other topic. It is very important, very important, to subscribe to our channel. So subscribe to our channel, like our video, share our videos, because you want to witness your fitness with us.